Charlie is currently the Executive Director of Finance for the Sutter Gould Foundation, but he spent 20 years in the healthcare industry. In the light of certainly our challenging healthcare times, this is going to be a wonderful presentation to learn from somebody that's worked in the industry.
When you get the right topic, all of a sudden, you're an expert. I started in healthcare in 1982. I say 20 years because it's gotten to the point where I just sound older if I become more experienced. We've been talking about healthcare reform in this country for a very, very long time, and since we're back at school, here's the quiz. We've been talking about healthcare since which one of these administrations? And somebody needs to answer.
Hey. Woodrow Wilson.
Correct. Teddy Roosevelt. The 1935 Economic Security Act is what gave us Social Security, and it was 7 pages.
8.
Oh, that's true. I was counting the number of gift cards I was going to buy. So the Patient Protection Act that everybody's talking about, the healthcare affordability, PPPHC, or the actual letters are, is over 2,000 pages. It's actually 2,074 pages. Now, the interesting thing about laws and healthcare is that the law actually doesn't tell us anything. It's simply a guideline for the rules and regulations that have to be created so that we know what to do. The rules and regulations will be over, this is the actual bill. The rules and regulations will be over 20,000 pages. I promise you. So we've got this great new bill, and those of you that love flows are really going to like this. So, how many departments? Well, okay, this little box right here, these are all the states. So there's 50. Yet healthcare is very simple, because healthcare is all about people. So I'm a healthcare organization, and it's all about my patients, people. It's all about my doctors, people. It's all about my staff, people. We're in the people business. So healthcare is really simple. It's a doctor in a room treating a patient to make the pain go away, let's say. So on this very complicated chart, in my simplistic view, the two most important boxes are the patient and, the doctor and the patient. And all we have is, now you can take your time, and I'm actually going to give you handouts so you can try to trace it back through and figure out how you connect the doctor to the patient. We have the IRS in here. We have the Treasury Department in here. We've got consumers connected with employers through taxes. This is the system we're creating. A lot of the money of healthcare, if you saw a pie graph, really doesn't go to the doctors. It goes to the inpatient facilities and the drug companies. When we try to do cost containment, it's like squeezing a balloon. You can keep people out of the hospital, but the drug costs have to go up. Now, that's independent of saying, the drug companies invent new things that end up costing more. I'm just talking about, if you don't take care of somebody one way, you have to take care of them another. So unfortunately, the true reduction for the cost of care is to either do things that absolutely have to be done in a lower cost setting, or stop doing some things.
This whole thing really mandates to your industry that you now have to change your competitive paradigm and reinvent completely your industry, or the likelihood is in the next couple of years it's going to implode, and it will all become government run, because there isn't going to be a lot of